Hello, welcome to the Health In Show, an affiliate program of Homeopathy World Community. You've come to the right place to tune in and participate with your comments and questions. Love is the greatest healer of all, but sometimes, in order to change our emotions, we must take action in other spheres of our lives. We speak with experts in alternative and complementary health fields and hope you will benefit in some small or great way. Remember, you are wherever your thoughts are. Make sure your thoughts are where you want to be. Welcome to the Health In Show, everyone. It is Monday, April 27th, that's 2015 at 7 p.m. Eastern Time, USA. Everyone around the world is welcome to tune in now or to view our archives later. We have a special guest, Fran Sheffield of Australia, and she will be with us in just a moment. Thank you to Amnon Nissan, our producer, and to all the people who are sending us energy in order to continue with these shows. Be here, support us in every way that you can, your thoughts and prayers. We're going to be talking about autism, but first we have a prayer for healing. And if you want to show that, it's on slide number 2. That is most especially poignant for so many people who are going to talk about their own personal miracle stories when we find out more about lives that are saved. And of course, we're grief-stricken from all of those who have been harmed from the avalanche and the earthquakes. So today I thought I would talk about safety and protection. Each person contributing their positive energy, wisdom, and soul connections create a miraculous web of healing, a sacred place of protection, and a mindset of safety for those going through fire, water, storm, volcano, because there was a volcano in Chile also, earthquakes, floods, and Fran says there was some stormy weather in Australia, lights out and power outages, and the small traumas that challenge our lives every single day. Let us pray for miraculous stories of survival. And this is really true because they are happening, and we're going to hopefully hear many, many stories of positive outcomes. So Fran is with us, and we welcome you. I'm waving hello to you across the miles, and we're going to make... You have a title on your first slide, Making a Difference for Children and Adults with ASD, Autism Spectrum Disorders. Mm-hmm. So, okay. Shall we? That's the number 1 slide. Okay, and on number 3, we are welcoming you to tell again, because you were here about 2 weeks ago, where we introduced you with your qualifications in nursing and midwifery, a Master of Health Science Education, homeopathic consultant and educator for more than 20 years, a mother of a child with autism, lots and lots of experience and caring for others, and probably the list could really go on longer about all of the speaking and lectures and consulting that you do and the work that you're doing today in the political arena, which maybe one day you'll be back for that. And we have a comment, bonsoir. The second part of Fran, it started already, so.
Because there was somebody there earlier.
Oh, okay.
45 minutes. So
Okay, so we're going forward. Slide number 4. And first, the first half, you were giving an introduction to mostly parents, caretakers, who were taking care of someone with autism spectrum disorder, and just a little touch of homeopathy with an explanation of two of the remedies, Nature Muriaticum and phosphorus, and it would be great if anybody wants to go back and see that again. And now we're going to move a little bit forward to a more advanced level understanding of how a case is managed. So I'll let you take it away. We're on slide number 4.
Right, thanks, Debbie. Yes, we spoke about, most of what we spoke about last time was parent-related information, and now we're going to unpack more what may be of use for practitioners. But parents listening in, it will also be of help to them too, to understand the process that a homeopath has to go through in treating somebody with autism. So to give some background information, so we all know where we're standing, there are actually 3 main ways we can treat symptoms. We can either palliate symptoms and relieve them, and this is whether it's in autism or with any other health problem. We can palliate them, relieve them. We can suppress them, which is push them under so that they can't be felt, and to all intents and purposes we're not experiencing any discomfort, we can go on with our lives. Or we can actually use the homeopathic approach, which is where we match a remedy to the symptoms. So rather than trying to push them under, we're trying to use a remedy or a medicine that mimics those symptoms and supports the body in the way it's trying to deal with it. And we find when we do that, what we actually do is, rather than just relieving or suppressing, we actually extinguish part of that symptom pattern, and the body that was struggling with the burden of that symptom or that disorder is able to move back into that area that was removed or extinguished and start to manage control over the body again. The vitality, the life force comes back in and starts to govern the body as the way it was meant to do, but wasn't able to because it was under the pressure of this disorder or symptoms. So we can either palliate, suppress, or match the symptoms and extinguish them by doing that and allow the body to resume control. So if we could just move forward to the next slide. So I'm on slide 5. That's where you are, Debbie? I think we may have a problem because I don't hear any sound at all.
Oh, you don't hear any sound?
Oh, right. Got you now.
Okay, we're at treatment can be applied at different levels.
Yep. And again, just back information, I'm getting a little bit of echo too, so if I'm halting and stalling, it's just with the echo coming back through the system. But so not only do we have to look at how we treat the symptoms, whether we're going to palliate them, suppress them, or match them, mimic them and cancel them, but we also need to look at which level we're going to treat at. And homeopathy or any medicine can be used for preventative purposes to treat trauma and first aid injuries, acute problems and chronic problems, and it tends to be more around the acute or the chronic area in which we can suppress or palliate symptoms. And moving on to the next slide.
Can you explain that again? You can suppress with acute remedy. What did you just say?
Yes, so with any form of medicine, so whether we're using homeopathy or whether we're using conventional medicines, we can suppress, especially around the acute area or the chronic area. Now, mostly with the conventional medicines we're used to, such as the paracetamol, you don't call it paracetamol there, you call it acetaminophen, or blood pressure medication.
Tylenol or aspirin?
Yes. Things like that. They don't actually correct the underlying problem that's causing the symptom of pain or fever. They actually just suppress that symptom temporarily in the hope that the body will correct it itself. And by the time the medication is worn off, the symptoms have gone as well because the body's actually been able to heal or correct something. But in chronic situations, that can't happen where we're just trying to suppress. So, for example, with blood pressure, virtually is on blood pressure medication for the rest of their life because they suppress that blood pressure or that high blood pressure while the medication's in the body. But as soon as it starts to wear off, up goes the blood pressure again. So another dose has to be taken to suppress that symptom. Now, that is fabulous in that it gives short-term relief, but the downside of it is it doesn't actually correct the problem, and over the period of time it weakens health, it weakens vitality, because from the homeopathic perspective we understand that the symptoms, the body's working with the symptoms to express the deeper disorder that it has. These symptoms are being produced in part of trying to manage that deeper problem, and that if we can suppress the symptoms, we can actually manage the deeper problem. And the symptoms, the body's working with the symptoms to express the deeper disorder that it has. These symptoms are being produced in part of trying to manage that deeper problem, and that if we can suppress the symptoms, we can actually manage the deeper problem. And we constantly suppress them. We work against how the body's trying to manage its health and how it's trying to heal at a very, very deep level. And with homeopathy, we've found if we actually come and use medicines that mimic the symptoms that the body's producing, that we get far more therapeutic effects. So we don't weaken the body, we support what it's already trying to do, and with that extra help, the body's able to correct its health problem and return itself to health. So we'd be expecting to see with homeopathic treatment, rather than that blood pressure continually needing to be suppressed by medicine or remedy after remedy, that over a period of time of treatment, that blood pressure would start to normalise. And this is a very important thing, we tell our patients too, to be very careful when that happens, because if you're on conventional medications that are suppressing that symptom, and the homeopathic medication is actually helping the body heal whatever's causing that high blood pressure, that if you keep taking your regular medication without checking your blood pressure, you're likely to end up in a state of low blood pressure. Start getting out of a chair or something like that. It's always wise to go and check the medication or your blood pressure and go off and see your prescribing conventional doctor to say, look, I need my blood pressure checked. Do I need this medication any further? So that's where we're talking about suppression. Conventional medicine mainly focuses on suppression, though occasionally we'll see it using the homeopathic effect without realising that. And most homeopaths are familiar with the common examples we'll use, things such as Ritalin or dexamphetamine for children who are hyperactive. And these medicines are stimulant medications, but when given to children who are already overstimulated, it has that cancelling out effect or that homeopathic effect, and the child improves. The only problem with treating with medicines like that is it's very much a one-size-fits-all approach, which suits some children very well, doesn't suit other children well, and because there's no individualisation as we would use with more extensive homeopathic treatment, it tends to be just a palliating approach where you have to medicate again and again and again. So we've done a quick whip around palliation, suppression, and matching symptoms.
Fran, I want to say one thing. I mean, technical. I know now why your cam is going in and out of focus. Your hands.
Right.
Your hands are closer, and when you bring them up, it focuses on it, and it goes in and out of focus. So, I mean, it's fine. Just, I know it's hard not to use hands when you talk, but do it, but try to not. Okay, let's go.
I might sit on them.
Okay.
Now the thing to remember when we're actually treating somebody, when we're trying to support the symptoms or mimic the symptoms, and we gave the example of Ritalin, but radiotherapy or radiation can cause cancer, but it's also used to treat cancer. So at that very crude level, we've got a homeopathic effect going on where we're matching symptoms. We're using something that can cause the same symptoms that are being treated. But the beaut thing about homeopathy, and I'm just looking at slide 6, I can't actually see where you're up to, Amnon, so I'm just stepping through my PowerPoint.
It's with you.
Great. The icing on the cake with homeopathy is we actually have a process by which we can remove the toxic effects of substances too. So we talk about potentization, and all potentization really is where that initial substance that we want to use for treatment is diluted and vigorously shaken in the liquid that it's diluted in, diluted again, shaken, diluted, shaken. So serial dilution and shaken gives you a remedy, a liquid remedy that can then be used to medicate sugar pills, but where the toxic effects of the original substance have been removed, but the therapeutic effect has actually been imprinted on that liquid and enhanced by the shaking process that happens between each dilution. So that's basically potentization, and the benefit of that is we can use quite toxic medicines very, very safely and get a very close match between the symptoms the remedy can produce, the symptoms the person's experiencing, and get a curative effect that way. Now, the reason why I've spend a fair bit of time discussing that area is because we start to get a lot of confusion when we talk about potentization. The people are inclined to think that anything that's a potentized remedy is a homeopathic remedy and they're doing homeopathy, when in actual fact that's not the case, because as we said, with crude medicines, we can palliate or suppress symptoms, or we can match them homeopathically and trigger that curative response. The same is true with potentized remedies. If it's not applied by that symptom matching approach, if the remedy isn't prescribed according to the symptoms, we can actually palliate or suppress, which might give short-term relief, but we don't get that deep curative effect that we want. And so this is what we need to be aware of with children, because there is a range of approaches out there at the moment using potentized remedies that are often perceived as being homeopathy, and we need to be very clear in understanding the differences there. Sometimes it's appropriate to use them, sometimes it's not, and that's what I want to go on and have a look at, and to understand a little bit better what we're doing or what homeopaths are doing and what treatment our children might be receiving. So I've got, going on to slide 8.
Oh, okay. Leave that. Leave 7 for a moment.
Oops, I've jumped through. Sorry, slide 7.
Okay.
So once again, we're just looking at serial dilution and succussion means potentization, and potentized remedies are not necessarily homeopathic remedies, and potentization is just a refinement that emerged from homeopathy, which allows us to remove the toxicity and enhance the therapeutic effect of the substance. The remedy becomes homeopathic when it's being prescribed according to that symptom matching process, that like treats like process. We need to keep in mind that potentization can also be used to palliate, which may be useful at times, suppress, though you have a hard job suppressing over the long term because of aggravations that might be occurring. But the very best treatment that we can offer people is if we do that symptom matching approach, which is the homeopathic aspect. So just moving on to slide 8. I've called it scaling the mountain and what's possible when. So I've thought, now how do I describe this? That there's various ways that homeopathic remedies can be, potentized remedies can be used, and what we may want for treatment. And I thought, well, okay, let's visualize a mountain. So here's our mountain, but moving on to slide 9, and you can see the arrow pointing there. And so the mountain problem that we're trying to shift the mountain. We're trying to get the mountain out of the way. But if you're looking at what's going on around the foothills of the mountain, let's call that the allopathic or the conventional approach. Now, the term allopathy is often well known by people in homeopathy, but not so well known by people outside. And all it means is allo means other, or it's an other approach to disease, whereas homeopathy is a similar approach where we match similar symptoms. Homeopathy is treating, allopathy is treating by approaches that mimic other symptoms in order to suppress or palliate. So if we look at the foothills around the mountain, that's where a lot of allopathic approaches going on, and it helps children. For example, supplementation is an allopathic approach because it's not actually curing. You're constantly palliating or suppressing the symptoms by supplementing when a child should be able to manage quite well on a particular diet, as are other neurotypical children, but they're not managing for whatever reason, so we bring in the supplements and they act as crutches or band-aids to hold the child up and support the child to try and normalise behaviour and function, but as soon as they're removed, the child starts to regress again. The same as some of the neuroleptic drugs such as Ritalin or risperidone, whatever's being used, that again we're trying to normalise behaviour or minimise symptoms, which we can do for a short period as long as that palliation or suppression's in place, but as soon as it's removed, it's gone. Substances down at this level, at the foothills or the base of the mountain, are also being used in crude forms. So we're not talking about potentized substances here. We're talking about things such as your conventional drugs and the supplements or herbal treatments or whatever that may be going on. So we get to the next phase and looking at that, and I've say that little first ledge, and that's where or some practitioners not familiar with homeopathy might be hearing, okay, homeopathy is meant to be great for these kids. On the internet, I can buy these combination remedies that treat hyperactivity or spaciness or fogginess. Let's give it a go and let's see if homeopathy really works. And so in terms of scaling the mountain to try and get rid of the child's problem, we've made the first step. We're kind of at the first ledge where we're using mixtures of remedies that aren't necessarily proven, or what we call isopathic remedies, or this for that. So substances where we may say, okay, maybe the vaccine has caused a problem, or maybe the antibiotics given during pregnancy or given not long after birth, or maybe exposure to radiation or the ultrasounds during pregnancy have caused the problem. Let's put these substances or these energies into potency, we'll potentize them, and we'll get them in, because there were a number of antibiotics and we can't remember which ones. Let's group them all together and get them all together in combination and see if we can improve the child's health by this approach. So that's very much using combinations of unproven or isopathic remedies. It's a this for that approach. It's not involving symptom matching, where we're going looking for the particular remedy that matches the particular symptoms that that child is expressing in their autism. But it's the very early stage of using potentized remedies. Next stage, we're actually looking at combinations.
Can somebody get well or improve with this? Because we're hearing a real lot about it. I don't know whether this is Tina Smith's or the other methods. I know Manfred Mueller uses these kinds of methods and supposedly gets results. So, I mean, maybe at one level?
Yes, and quite possibly. And what I'm going to suggest is the homeopathic approach always gives the far superior results if we can actually match the remedy to the symptoms. Where that's not possible, these other situations of where remedies are used isopathically or this for that or in combination may be of help to the child. In homeopathy, we've kind of got the two groups. We've got the groups that are the purist, who only want to do the symptom matching, that remedy. If we can't do that, we're doing nothing. I see many kids in my practice, and I prefer the straight homeopathic approach. In actual fact, it is only the homeopathic approach where it's being done by conscious decision of matching symptoms, looking for a remedy that will treat those symptoms, and then using that to treat the child. But in some instances, that's not possible. So if we can just jump ahead, Amnon, to slide 13. So the homeopathic approach is the peak experience. Now, if we can imagine that we're scaling a mountain, not many of us actually get to the top of that mountain. Up there, it's beautiful. We get a fabulous view. The air is clear. We can see forever. But sometimes we're not able to get there, either because we don't have the physical fitness, we don't have the training, we haven't been in training to scale the peak to that height. And so there are fallback positions that people go to. So where we talk about, say, Tina Smith's approach, what Manfred may be doing, can you get good results there? Yes, you can, but usually it's not from a highly symptom matching approach. It's trying to do more of a shotgun approach of, okay, saying, we know vaccines harm some children. Maybe that's the cause of this child's autism. Let's give the vaccines either singly or in combination and see if we get a response. And sometimes you will get a response. Now, what homeopaths will say is that response is usually, again, only because there's that principle of like treats like there, that for some children, those remedies, even in combination, are going to have that symptom matching effect. And when that occurs, you get a good response for that child. So it's not as if it's a separate or a different or a better approach. You're still working at the level of either palliating or suppressing symptoms initially, or potentially getting that symptom matching effect. But it's happening more by, okay, let's whack these together in a bottle, cross our fingers, and it's kind of a maybe slightly educated guess, but if we put it together, we'll try it and we'll see if we get a response with that child. If not, we'll move on to something else. Where we're talking about single remedy prescribing that some homeopaths call the classical approach, though I don't particularly enjoy that term either, because classical means many things to many different prescribers, and you'll find that they all have different variations in their practice, even though they're calling themselves classical. But where you're using the single remedy approach, it's usually involving quite a highly educated discipline process of deliberately trying to find the remedy that best matches this child's particular symptoms. Whereas in the CEASE and the other approaches, it tends to be more of a scattergun or shotgun approach of let's put things in and hope we get a match. So I guess that's what I'm trying to explain. Both for parents and practitioners would be aware of this, so that when people are having treatment, they know which level of the mountain they're at. I'm just looking at which mountain on my slides here I will go to.
I think we skipped 12,
if we
11 and 12.
If we could go back to 11, where we've used combinations of unproven remedies. So that'd be where we're talking about the antibiotics or the vaccines that haven't been through the homeopathic pathogenetic trials, as we call it these days, or the old-fashioned term provings, of where they're tested on healthy people again and again to see what symptoms are produced, and then we prescribe them according to those symptoms. That hasn't happened, if we go back to slide 10, at this level. This is where the remedies have been unproven or untested, but we think these antibiotics or these vaccines or this lead or this arsenic, lead and arsenic have been proven in homeopathy, but these toxins might have caused the problem. We don't know the complete symptom range when tested on healthy people, but we're going to give them to this child in potency and see if we get a beneficial effect. And if you do get that symptom matching effect, you'll get a positive result for that child, but it's more of a let's try and see approach. So going to slide 11, this is more where remedies are being used in combination of proven remedies. For example, where children might have arsenic toxicity or high lead levels or high mercury. Proven remedies may be used in combination to try and assist this child, or where there's been a huge loss, grief, or situation of fright, shock, panic. Our better known grief remedies or our better known shock and panic remedies are put together in combination and given to this child or this adult to see if we get a beneficial effect. So you can start to see there's a little bit of a closer attempt to match symptoms or possible causes at this point, but still it's not that more precise process that takes place at the mountain peak. So if we go on to slide 12 and have a look there, that's where people start using single remedies. But again, it might be either for an acute phase. I've got my hands up in front of me, I've just realised. It might be for an acute phase and single remedies are used for that, or where there has been a grief and you're worried that that's really had an impact on the child, or a big shock or a fear or a loss in the child's life that's contributed to susceptibility towards developing autism, and so that remedy may be used singularly. Now, the advantage of using single remedies is that you can very clearly see the effects of that remedy. When remedies are given in combination, all you can look and hope is there's an improvement. If some things improve, if some things aggravate, or if things you're never quite sure which remedy did what. So you're stuck with, if you need to change potencies or treat further and try and improve the other ones, you think, okay, do I put this antibiotic into the next mix? Or what happens if I give all of these ones in potency again? Some of them may not have had any effect, and what we know from our homeopathic experience, eventually you will produce aggravations in that child. Or do I leave them out altogether? Where do I go? So multiple remedy prescribing creates confusion for case management further down the track. As we get closer to single remedy prescribing, we can very clearly see what that remedy has done, what remains, what worsened, what improved, and we know where we've got very clear guides from where to go next in treatment. So if we go to the final slide of the mountain, So once again, up onto slide 13. So this is the peak. This is where we use single remedy prescribing. We take the case of that child or that old adult very carefully. We go off and we look in our materia medica. We try and find the remedy that best matches those symptoms, and we prescribe that. And that gives us guidance on where to go next. And the point I want to make is that for purists who stay at this level, yes, that is homeopathy. That is true homeopathy, as against just using potentized remedies. But as you can see, it can be hard to reach for some people or some children at some times. Mostly it's not, but for whatever reason, it can be difficult. And you've still got children struggling. So what I say to other practitioners who are wondering what to do, or parents who are wondering what to do, as a fallback position, some of these remedies in combination can be used, and I'd prefer it happening at the more educated approach, just to see if we get some movement at that point. It's not the pinnacle of treatment, it's not the best of treatment. It may be homeopathic in effect by good luck, because one of the remedies in there may match the child's symptoms. It does make ongoing treatment difficult, but in the failure to find the best single remedy, it's better than nothing. And because the remedies are in potentized form, they're safe to use as well, with one proviso.
What is the proviso?
If the remedy is stopped, should any aggravation happen in the child. Now, when we poke, and I know this is not going to be new information to you and many people listening, Debbie, but when we test our remedies again and again on healthy people, we'll test them to the point where they start to produce symptoms. We'll record those symptoms down, and then we know that that remedy will be helpful in treating those symptoms in somebody who's unwell with them. But the same thing happens when remedies are given again and again to children or adults. The ones that are irrelevant or unneeded, or the ones that are being given more than what the child or the adult needs, will eventually start to produce symptoms in them. And when that happens in that sort of scenario, we call them aggravations, and they can be similar aggravations, dissimilar aggravations, and we're going to go on and have a look at those in a minute. But they're aggravations. What I am seeing happening, though, when people use potentized remedies, and it can be parents, it can be other practitioners, and it can even be sometimes homeopaths using them, aggravations are often being presented to parents as a detoxing effect. And I've seen parents being given instructions to keep dosing in the face of aggravations. And I want to say to those parents, that is not a detoxing effect. Stop the remedy. The golden rule with homeopathy is, if there's an aggravation, you always stop treatment. You let the aggravation settle, and you see what follows in order to know where to treat next. So please, 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 people, if people have been told out there by others using potentized remedies that just a detoxing effect, never ever accept that. We're looking after children who often can't tell us clearly what's going on with them. We're looking after adults in the same situation. In homeopathy, aggravations occasionally occur. They're usually minor. They're not to be worried about. But if you keep dosing in the face of an aggravation, that aggravation will worsen. Eventually, the remedy will have to be stopped, or gradually the body may adjust and acclimatise to that degree of dosing and start to either ignore the combination of remedies being given or just cope with it. But while that aggravation's in place, what we're actually doing is we're stressing the life force, and we're causing to expend its energy in this aggravation when we want that energy conserved, so it's able to mount the rebound response that we want to create a curative effect when the right remedy is being given for what it needs. So never dose in the face of an aggravation, always stop and let it settle. Aggravations are normally very mild. If you keep dosing, they won't be so mild, so stop, and they're not detoxing effects.
Okay. So are you going to tell us what Hahnemann said in these cases?
All of these are through his writing. So looking at the responses, if you look at Reed Hahnemann's, it's not just in the organon but in the chronic diseases, you can actually see what he said in relation to the remedy and dosing in this area. I guess if I was to pull the aphorism that would be most relevant is homeopathic treatment, or the goal of homeopathic treatment is gentle, permanent, and rapid. Sometimes we're forgetting the gentle aspect of it. We're wanting permanent, we're wanting rapid, but we're also wanting gentle. Homeopathic treatment shouldn't be a rough trot for child or adult.
Okay, so this was slide number
going on to slide number 14.
14. Okay, so did you already just mention this? My mind was wandering.
You're wondering what Hahnemann was saying.
Yeah, I was wondering what Hahnemann was saying. Okay, go ahead.
Slide 14, and this is what I'm hoping to share with practitioners, and many of them will already be doing this, I know, but it's always good to go over the old ground again. When we're single remedy prescribing, and that's the mountaintop experience, that's what we're looking for. You're able to clearly see where you're going, and you're able to determine or understand what the responses to the remedy you've prescribed mean. And fundamentally, there are 6 different responses. I've got number 7 there, but that's virtually because there's no response to the remedy, so I thought I'd better not call it a response. But if we look at the 6 different responses, you can get a curative response, a similar aggravation, dissimilar aggravation, accessory symptoms appearing, the return of old symptoms, and discharges and eruptions. Now, these are the sort of things that can follow the prescription of any homeopathic remedy, and they all mean something. They all guide the practitioner on where to go next. So we're going to unpack them a little bit. If we go down to, and it's one of the reasons why single remedy prescribing is to get fabulous treatment in the long term is the best way to go, because you can easily see where you've been and where you're going. I should just mention too, with you raised Tina Smits and the CEASE approach and things like that too. What's happening there too, that we, as from the homeopathic perspective, that we shouldn't overlook, Debbie, is that it's not just potentized remedies being used. Often a lot of biomedical treatments are being used as well. And I know in reading some of the writings in this area, I thought we were going to be able to attribute improvements to those children, all improvements to the homeopathic or the potentized remedies, when a lot of supplementation and other things are going on as well. So it becomes quite a confusing area to work out what's happening. But just jumping back to single remedy prescribing again, so this is the ideal, this is what we want, and this is what we see in many children. We get quite a curative response, and what we're seeing is just that the child or the adult symptoms start to improve and gradually disappear. It won't happen with just one dose of the remedy. For something like autism, it usually requires several potencies and several doses over a period of time. But with ongoing dosing, the child's getting better and better and better, and the remedy's needed less and less and less. And this should be a sign that we're heading in the right direction as well, that the remedy's not needed at the same frequency constantly, that as the child improves, the remedy's needed less and less, and they go on to experience a very good improvement or cure. And again, depending on the degree of structural damage that's taken place in that, we can regrow things, we can stimulate healing, but if there's been severe, say, neurological damage, or I guess looking at an adult that may not be autism, but if a joint's completely destroyed through rheumatoid arthritis, you are going to get healing and settling of inflammation in that joint, but you're not necessarily going to get a perfectly functioning joint again, because the basic template for that joint has been destroyed. And the same with children with autism, though many of them are not at that point, and you get very, very good improvements with them. So jumping onto slide 16, curative response means the correct remedy has been prescribed, the child's symptoms and the symptoms able to be produced by the remedy have been matched well, the remedy's been given in the correct strength or potency, in the correct amount, and you can amounts of the remedy can vary from, some people are giving 10 pills, some people are just dissolving a pill into a bottle of liquid and giving a teaspoon dose or drops out of that. It can vary enormously, and that's quite significant depending on the sensitivity of the child to the remedy. The child who needs one drop out of a bottle is not going to cope with 10 pills. They're going to aggravate very easily because their sensitivity won't allow for that, and that needs to be factored into treatment as well. Right frequency or the right number of repetitions. So the worst thing, because many of these children are quite sensitive as well, and we know from our homeopathic philosophy and what Hahnemann said, the closer the match the remedy is to those symptoms, in actual fact, the more sensitive they will be to it, and the more strongly they will respond, either positively or negatively, depending on the size of the dose. So where we're seeing children sometimes being dosed again and again and again, day in, day out, with remedies, and there's not much of an aggravation going on, it's really a factor that there's probably not much of a match going on there between remedies and symptoms as well. So that sensitivity or that ability to respond to them not taking place as well. So we need to keep that in mind, that the closer we get to symptom matching, the more sensitive the person will be to that remedy, and the more carefully we need to monitor our prescribing in that situation. So moving on to similar aggravations. So we've spoken about aggravations. We've said that they're normally mild. It's a worsening of symptoms in the child or the person, or you might want to call it an intensification. They're usually short-lived, very mild. And what will happen in the case of a child with autism, their existing symptoms, where we're talking about similar aggravation, because we've also got a dissimilar aggravation, but in a similar aggravation, their existing symptoms will worsen a little before they improve. So if you had a child who was stimming, I'm going to lift my hands up, but stimming a lot with their hands, or humming and singing, putting things in their mouth, chewing things constantly, with a dose of the correct remedy, what we sometimes see after the dose, those symptoms will intensify a little bit. So rather than just wandering around putting something in their mouth every half an hour, they might be gumming on something excessively, or the stimming might intensify, or the humming, walking around aimlessly, round in circles, humming for a period. Now, that usually only lasts for a matter of half an hour to sometimes several hours. In very sensitive children, it can last a day or more. It's not toxic, it's not dangerous. But as the effects of the remedy leave the body, those symptoms leave as well. And then we start to get, with no more dosing at all, we start to get the follow-through improvement happening, where the body moves back in and starts to restore balance and correct the problem at a very deep level. So what we're doing in actual fact, the child's got one set of symptoms, we're adding a remedy that mimics those symptoms, so we're getting a combination or an overdose of symptoms, partially from the child and partially from the remedy. They intensify for a short period while the remedy's in the child's body. As the remedy leaves the body, the the additional symptoms leave as well. The child goes back to the normal level of symptoms, but that cancelling out effect happens as the remedy leaves. You get a much improved picture. The child's symptoms improve. The body's life force, vital force, moves into that area that was taken up by the stronger symptoms, and starts to restore balance, and you start to get improvement. So that's all homeopathy is about. The remedy coming in, matching the symptoms, extinguishing them in the same way we'd use fire to fight fire. As the remedy leaves, and the life force or the vital force moves back in and takes up that area of extinguished symptoms and starts to restore balance and healing back into the body in that area. So that's called a similar aggravation when that happens, and that's a good sign. We don't, it's not necessary. Sometimes it all happens at just a completely energetic level, and you don't get the breakthrough on the physical area. It's happening down at that energy level. But it's always followed. When you see it, if it's followed by an improvement, we know, great, we've got the remedy right. The next dose may need to be given in a gentler form, so we don't have that initial aggravating effect for that child or the adult. With the people I'm treating, I generally say to them, and you can kind of get a feel for it depending on the intensity of the aggravation the child or the person experienced. You can get a feel for whether it was just that initial rebalancing effect taking place and the body go, oh, on its first exposure to the remedy, or whether it is a case of sensitivity, that that child is very sensitive to that remedy, the next dose needs to be reduced. If it's a case of where the child, it's just that initial rebalancing effect, I'll often tell the parent to give the same dose again, and usually we'll see no aggravation at that point, just the follow-through improvement that we want. If on the second dose there's even a milder aggravation, I'll get the parent to reduce the dose. So instead of giving, I work with liquid remedies, so instead of giving 5 drops, I might say give 1 drop, or put 5 drops into a quarter of a cup and give a teaspoon of that. I'll make the dose gentler. It still works, but you do away with the aggravation. So again, you go back to that ideal of cure, which is gentle, rapid, and permanent. You're achieving that gentle for the child. So moving on to slide 18, and Debbie, please interrupt. So
you are a very fast talker. I'm writing notes in the chat, so anybody who wants to come in and see where we've been can pick up with it. And you've been just full of great information, very educational. So we're at gentle, rapid, and permanent cure, which sounds like a Hahnemannian quote to me.
Aphorism 3, isn't it?
What is it? Aphorism?
3?
3? Could be. I wish I have them memorized, but I need something for the brain.
Yeah.
Okay, so we're really moving along. So you think we're going to hit all of these slides?
Yeah. Okay, I better hurry up, hadn't I?
Well,
slide 8.
We'll have you come back again. What can I tell you?
Slide 18. So what should be done if there's a similar aggravation? This is for practitioners and parents to be aware of. Most practitioners will know this. Don't give another dose of the remedy. Let this usually mild and brief aggravation settle following improvement. Give a gentler dose only when any improvement stalls or symptoms return. So that's especially for parents who may be treating acute problems and so on. That's how you manage a similar aggravation. That's where the child's existing symptoms intensify. But there's another type of aggravation that can take place too, and this gives us great information. This is where the child has, or the adult has, new or different symptoms develop. So it might be the child who's never had dry lips before. They get a dose of the remedy, the symptoms of autism continue, but they start to get very dry and peeling lips, or the lips crack for a day or so. Or they might suddenly crave ice cubes, like they're going out of fashion, and the child's never had a craving for ice cubes before. Or they might sit very quietly, or they might have disturbed sleep when they actually stay to sleep quite well. These are symptoms that the remedy is able to produce. The remedy's been given to the child, so it's also producing those symptoms in the child, but it's not a very well matching remedy, so it's not doing anything to the child's original symptoms. It's just producing these new symptoms for a short period, and the child has the sensitivity that they're being expressed on the physical level. So what happens there? So just reading there, what happens? New and different symptoms appear for a short time, but there isn't any improvement in the child's original ones. So what it means is the remedy was wrong. So with these aggravations, they're great. You can tell whether you've got the right remedy or whether you've got the wrong remedy. This remedy didn't match the child's symptoms, but the dose was strong enough or the child sensitive enough for him or her to experience the symptoms the remedy can potentially treat. So what you do next is the homeopath should reassess the symptoms, pre-existing and those from the aggravation. With homeopathy, nothing is lost. Symptoms from the aggravation can also be merged with the original symptoms of the child to find a better matching remedy. And the reason why we can do that is even with an aggravation, a person can only produce an aggravation out of their underlying susceptibility or weakness or tendencies. So it's what's the potential to happen in the future, symptoms that aren't there yet, but the potential is there for them to develop in the future. So knowing that, we can combine the symptoms of the aggravation with the original symptoms and look to find a better remedy that covers that cluster of symptoms, move us a little bit closer. So the next
Wait a
sort
minute.
of...
I'm asking, did you understand what she said, Amnon?
No.
Okay, because that was like, whoo, that went really fast. And I know that I probably think I caught it, but you might need to just say that one more time. The fact that a child or an adult gets a remedy and now they're having symptoms that they never had before, like you said, I've never had dry lips, I've never had cracks in the corners of my lips, I've never craved ice before, and now all of a sudden I want to eat ices and my lips are doing this. So does that mean that I need to add that in somehow as something I am sensitive to? Or you also said that if there was no other improvement, then we're on the wrong... I'm just thinking
Yes.
out loud. So either... help me out here. So
Right.
we've got a couple of things happening. One is, are we seeing any improvement at all? Like, do I
No.
feel like fantastic and I have cracked lips? Or
No,
do
no,
I...
there's similar...
Go ahead.
They've still got your existing symptoms, so there's been no improvement, but you've got a few additional symptoms on top from taking the remedy. So what we can do with especially with the very strong characteristic symptoms from the aggravation, you can merge those with the existing symptoms and go looking for a remedy that covers the existing symptoms which haven't improved, but the current symptoms of the aggravation that are present, and look for a remedy that potentially covers that combined cluster of symptoms, because that will give you a much better match overall. So even aggravations can act as pointers to the more likely needed remedy, as long as they're combined with the original unimproved symptoms.
Okay.
And that's where you can see if potentized substances are used in combination, you start to lose the ability to do this. You don't know which remedy caused the aggravation. You don't know. Yeah, it just all becomes confusing, and it's very hard to know the way forward, which is why the benefit of single remedy prescribing, ongoing treatment of a child or an adult's case, can be managed in quite an intelligent manner. You can make very clear decisions about what you're going to do and why, knowing where you've been and where you're aiming for. The body's giving you the instructions of what to do next, rather than just putting a group of remedies together and hoping for the best.
Great. You really need to find somebody who knows how to do this, because this is just so complicated, and having the wisdom and knowledge and experience to understand the remedies to the point that you need to really requires somebody who's been practicing and getting good results for at least 10 years. Sounds like...
But by the same token, that they are guides. So all you've got to do is look at the case and say, okay, what's happened here? Have the original symptoms improved? No. Okay, and we've got new symptoms, right? I've got a similar aggravation going on here. That means I haven't chosen the best remedy possible for this child. I need to look again for another remedy. Yes, and so it's the knowing how to look, where to look, and having some familiarity with the materia medica, or accessing the information in the materia medica, which is, the groupings of symptoms that match our remedies, and best knowing how to apply that. That's where the skill is. But understanding these responses to the remedies are actually very similar. We may not be quite so skilled in where to take the information after that if we're not familiar with accessing the materia medica and new remedies, but these guideposts are actually very simple. I think what makes it hard for us is nearly all of us have grown up with conventional thinking, the way medicines are used there. And so even as students, we're always trying to apply homeopathic remedies via a conventional approach, and it doesn't work. And we need to, in some ways, do a complete paradigm shift to understanding palliation, suppression, and curative response by symptom matching. As soon as we can grasp that, we can then understand these responses.
Mm-hmm.
If we're still just looking at cause effect, that's a little bit harder. So I know I told you I'd keep this under an hour, so I'd better hurry up, Debbie, but stop me if I'm unclear.
Keep going.
Next response is accessory symptoms, and Hahnemann talks about this very clearly in the Organon. When we're seeing accessory symptoms, what you'll notice is the child's symptoms, the original ones they came to you with, improve, but in the process, one or two new symptoms appear for a short time. With a dissimilar aggravation, where the original symptoms didn't improve at all and they developed additional symptoms, in accessory symptoms, the original symptoms will improve, but they'll develop new symptoms. And Hahnemann advised the reason why this was because we don't have completely matching remedies. There's a partial match between the child's symptoms and the remedy that's prescribed. The match is close enough that we're getting some improvement, we're getting some extinguishing of those original symptoms taking place, but by the same token, because there are additional symptoms in this remedy that the child doesn't experience, and because the remedy is being given again and again, the child's having a semi-proving or experiencing some of the symptoms of this remedy. And what Hahnemann advised, and which is very true and which I see in practice again and again, if you can find a better matching remedy, go to it, because if we can reduce those accessory symptoms, but sometimes you can't find a better matching remedy. If the accessory symptoms are just mild things, and they usually are, for example, it might be itchy soles of the feet, or they might get sweaty hands, or there might be an increased thirst, as long as the original symptoms are improving under treatment, just leave these accessory symptoms to potter on of their own. As soon as we no longer need the remedy or can stop the remedy, they will disappear out of the case as well. They're only produced by the remedy, they're not toxic, they're not harmful, and they'll disappear when we no longer need the remedy or when we need to change to a different remedy. So those are accessory symptoms. And going through to slide 23, what it means, the remedy partially matched the child's symptoms. While it was able to trigger a healing response, the child also experienced some of the other symptoms the remedy had the potential to produce and treat, because it wasn't a perfect match. But sometimes it's as close as we can get, and we have to live with that. What should be done next? If a better matching remedy can't be found, and if the accessory symptoms are minor, treatment should continue. The accessory symptoms will disappear once treatment is completed and the remedy stopped. Okay. So that's that response. That's how we manage that one.
That was 24. Okay.
Moving on to slide 25, we're looking here at a return of old symptoms, and as you know, as homeopaths, we love this. And what happens here is the child's existing symptoms improve. So, for example, their poor eye contact, their stimming, the craving for dairy products or bread, the confusion, that starts to improve. But in the process, mild symptoms from the past return for a short period. And with a child with autism, it might be a rash they had as an infant, or a little bit of cradle cap on the head, or sweatiness of the feet or the hands that has long since passed, or giggling in their sleep. Things that happened in the past but disappeared start to come back for a short period. And as you know, when homeopaths see that sort of response, Debbie, we get really excited because it's called a return of old symptoms, and it's the body's working backwards through the catalogue or the layers of problems that have built up over that child or that adult's life, and it's going backwards and finally getting them up and out and processing them and healing whatever's underpinning them completely. So what it means, going on to slide 26, the correct remedy was prescribed. The old suppressed symptoms are now being externalised and fully healed along with the current symptoms. So we're really happy when that's happening. We see it as a process of deep healing.
So in this case, everyone must be patient must understand what's going on, not be worried or have any anxiety if they see something, because very often, let's say it's an ear infection, then the parent may run to the doctor and get antibiotics, and then once again they get the medication, and then everything just collapses and comes back again with the autistic type of symptoms.
Yes, exactly. But in the case of ear infection, typically, if they go to the doctor won't find it's if the symptoms of the infection return. So it won't necessarily be the infection itself.
Mm-hmm.
Occasionally, I've seen something like that, but normally it's the symptoms.
Well, you said like eczema or skin, so then you're putting cortisone on it or something like that.
Yes.
So this is
Yes.
an educational process for the parent or for the adult, because they just automatically have a tendency to want to eliminate this discomfort.
Yes, exactly. Suppress the symptom or palliate the symptom, which doesn't actually cure when the body's trying to get it up and out. Now, there's one proviso there too, because it's not eczema especially. It's if the eczema's mild, no big deal. Yes, just live with it, and we'll watch. What happens if the child's continuing to improve and improve and improve? We don't necessarily dose again, because if we give repeated dosing in very close succession, it's going to push that symptom to the surface too quickly, and you're going to get an aggravation or exacerbation of that eczema that's uncomfortable for the child. So it's gone beyond return of old symptoms. It's stirring up too much too quickly. Sometimes that happens in practice, mainly because we haven't realised the sensitivity of the child in prescribing, or the parent's gone away and thought, oh, the remedy did so well, I'm going to give a few extra doses. And in that case, where if the eczema is really flaring and the child's comfortable, and this can even occur with similar or dissimilar aggravations, and the parent has the cortisone cream, I will say use the cream just enough to relieve the intensity of the symptoms. Don't slap it on everywhere to push everything completely back in. Use it just to relieve the intensity, because it's not fair to have a child or an adult suffering while we have them wait out an aggravation or return of old symptoms.
What about something like an oatmeal bath or other?
Yes.
A lot of people are now using aromatherapy and essential oils. Is this okay?
Yes, absolutely. But again, as long as we understand that it's not actually treating the symptoms, it's just palliating. In the past, some homeopaths have said, no, you're not to do anything, you're just to ride it out.
Mm-hmm.
If you can relieve the intensity of symptoms in a way that's non-harmful, please do, because once we've got to back where the symptoms are just minor, treatment can pick up and progress, and the dosage of the remedy can be adjusted accordingly. But to expect people or children especially to put up with horrible weeping eczema and things like that, that's we don't need to do that.
Okay.
We can use our remedies intelligently to either or other substances intelligently to palliate, or hopefully not suppress, but palliate a little bit as well when that's needed, if that's going to be the better short-term option for that child or that adult.
Okay, I think that answers slide number 27.
Okay, moving on. Discharges and eruptions. What happens? A mild skin eruption. So yes, there's some overlap in these responses, but a mild skin eruption or discharge appears, but otherwise the child is happy, has good energy, and their original symptoms improve. And Hahnemann talks about diseases, the body will often use these processes as a vent. And if you want the old terminology of expelling bad energy or toxins or things like that, but it is as if the body will always move its problems and its symptoms away from deeper areas and more important organs onto more superficial organs. It will try and externalize its problems during healing. Or have a vent or a discharge, and we frequently see this. And for example, a child may have a runny nose, chronically runny nose for about a week or so, just watery discharge, but the parent says, oh, they've got so much energy and they're so happy and they're cooperative and they're compliant. We would just see that as a bit of a vent, or just a discharge and eruption, live with it. A little bit the same as eczema. We don't want to race back in and suppress it with cortisone creams. If it's minor, we want the body to be able to externalise the problem. We don't want to discharge. We don't see that as a problem if the child is healthier at a deeper level. It soon will pass as well. Mm-hmm. So moving on to slide 29. What it means, the body is trying to externalise the problem and is using the eruption or discharge as event. As healing progresses, the eruption or discharge will no longer be needed and it will disappear as well. Mm-hmm. What should be done next? Be patient. Don't suppress the eruption or discharge, as the suppression will disturb the healing process. And I think that this is one of the things that you were going to mention too, Debbie, that if we do suppress the problem, we actually reverse the healing that's taking place. If we mm-hmm. stop the body being able to externalize things, we actually get a regression. Parents will tell me, the child's starting to become unfocused again, or emotional, can't stand touch, just can't start to become sound sensitive again. So all the gains we made, we start to lose if we suppress the surface problem. It's much better to have the surface in a moderate, controlled way, let the body work it out and allow improvement to continue. So I'm jumping all around the place. Back to slide 30. If the symptoms are pronounced, minor palliation should be applied, but only if it's pronounced. But usually that's not the case. Usually they're just mild affairs. I don't want to scare anybody about aggravation, so usually very mild, interesting events, very mild and minor. Mm-hmm. Okay, moving on to 31, no response. What happens? There is no obvious improvement or worsening in any of the child's symptoms. What that means, the wrong remedy's been prescribed, and you may need to give the dose 2 or 3 times to check that that's the case. If you're not getting a response, you're probably way off the mark. You need to take the case again, look at the symptoms, find a better matching remedy. What it means is there's no sensitivity in the child to that remedy. There's no matching between the remedy and the child's symptoms. What should be done next? Reassess the child's presenting symptoms and prescribe a new and better matching remedy. More info about aggravations, and we already discussed some these things. So we're on slide 34. Contrary to some misconceptions, aggravations are not an essential or expected part of treatment. However, sometimes they're unavoidable. They're usually mild, short-lived, and interesting. They're not part of a detoxing event, and dosing into the aggravation should not be done if vitality is not to be weakened or exhausted. So again, whenever the child is aggravating, you're expending energy, you're expending, it's a stress on that life force or that vital force within that child. And that's what we're depending on to be strong enough to come back and restore balance in the body once we've extinguished some of the symptoms. So we don't want to weaken it or stress it unnecessarily. Aggravations disappear without causing harm. The remedy is stopped because, remember, they're purely energetic in nature. They're not toxic with the homeopathic remedy. They also appear to exercise and strengthen the underlying vitality. And this is something we picked up for Hahnemann's advice on provings and what we've noticed in our own provings, that where people are given a remedy again and again to the point of producing symptoms, Hahnemann, you'd think, oh, gee, that'd be a bit dangerous, wouldn't it? But in actual fact, stressing the body mildly like that actually builds resilience over the time. It's a little bit like we can either keep our plants in a hothouse and don't allow them to have any exposure to breeze or wind or insects or things like that. And they might look beautiful, but they're actually very fragile plants. They don't have they're not very vital plants. Or a tree that's tied up with stakes and so on and not allowed to feel the effects of breeze and wind, had a very weak root system. The same's true to us. If we don't have an immune system that's exposed to the viruses and the bacteria running around, if we're not exposed to changes in weather and so on, we start to weaken and we become quite fragile as well. The same has been noticed with homeopathic remedies. If somebody is in controlled manners and processes exposed to the effects of homeopathic remedies, there's actually a strengthening effect. We build stronger roots, and for this reason, and you'd know, many people are quite happy to do provings because they have ongoing health benefits. The thing is, you don't want to dose repeatedly into a improving or dose repeatedly into an aggravation, because that's when you start to overstress and exhaust things.
I really love what you just said. I agree wholeheartedly with that. And I believe it's true that plants that are out in their natural environment in nature create all of these special active ingredients that are medicinal for humans and other animals. And if you take that same plant and put it in the hothouse or greenhouse and take away all of its natural stressors, then it does not any longer produce the needed protective chemicals, and it actually reduces its effectiveness as a medicinal agent. And so also, I'm just giving my own philosophy. We as humans are constantly getting life tests and challenges and stresses to grow, to improve, to make better humans.
Mm-hmm. And there's a lot of research to back that up. And if we're just looking at the plants that you were talking about, and you'd probably know about this too, that where you were talking about the chemicals, that they've shown that the chemicals a plant produces when it's under stress from fungus or insect, it produces chemicals to try and protect itself. Those very chemicals are the things that, when we ingest, actually protect us against cancer as well. And if you just, as you said, eating something grown in a hothouse or something that's been sprayed with this and that, it's not only the toxins you have to worry about, it's the fact that you're missing out on these important chemicals that we use to prevent our own cancers.
Yes, we could do a whole show on how we live within our environment. And so, like, if you mass produce a whole bunch of a plant and it doesn't have what it would normally have, all the different varieties, then again, it's not able to create and process all of those special benefits for every living thing in that environment.
Yeah. Why does wisdom only develop with age? Because when we're young, we think we're impervious, and we hear about things like this, and we still go off and live life until damage. And as we get a little bit older, we start to pay a bit of attention to these things.
Yes. Okay. Beautiful. Beautiful. So go ahead, and where are we up to? 35. Okay.
Yes. So more info about aggravations. They can happen with the rebalancing effect of the first dose. And if that's the case, you won't see it with the second or third dose. You don't need to change anything. But they also happen when the person is hypersensitive to the remedy, the dose is too strong, or the dose is given too often for what's needed for that person's sensitivity. And typically, I'm treating children where I have some children who need a daily dose of their remedy in a particular potency, and I've got other children where once every 6 weeks is all they need. More than that, and they'll aggravate, but they progress quite nicely over that 6-week period just on one dose. And the child who only needs the once every 6 weeks dose progresses just as quickly as needing the daily dose. So again, we tend to think conventionally when we come into homeopathy, and we think we need to dose on schedule, and it's very hard to get our heads around the fact that we need to not only individualise the remedy for the patient, choose the specific remedy that particular patient needs, but then we also need to dose according to what that individual needs as well, and it can vary enormously. Combined with that, with ongoing improvement with this style of treatment, you need to change potencies, and doses change with potency, and also dosing or frequency of doses changes with improvement. So there's a lot of management in it, which is pretty easy, but you need to keep a tab on things. Going on to slide 36. Sensitivity to the remedy should be checked with a test dose at the beginning of treatment. So I'm saying what I do. I don't want to be sending a child away who could be non-verbal and causing huge amounts of stress because I've told the mother, okay, I want you to give a daily dose for 7 days and then call me back. I just give one dose and look at what response. I get feedback from the parents. How did they sleep? Any changes in behaviour? Any physical problems come to the surface? And then we'll work out dosing from there on. And going on to the second bullet point, liquid remedies are the preferred option for treatment as their dose is easily adjusted to suit sensitivity. some of these children are very, very sensitive, which is why they were affected by whatever happened in their environment and they've gone into autism in the first place. And so one pill to them, that even if it's the right pill that could always produce an aggravation for them, you can actually dissolve that pill down into liquid and you can give them drops of that, or you can break it down even further. You can even give sniff doses or olfaction doses of a remedy, so that we're actually quite good homeopathic practice. We become very skilled at adjusting the remedy to match the sensitivity of that child to that particular remedy. So there's no unpleasant effects for them. Now, ongoing consults for practitioners. This is what I do. Practitioners have various styles, but this is what I suggest. Always ask, break symptoms up into 4 areas. What's better, what's worse, what's new, and what's the same. Because by doing that, you can then look at the responses, what's happening, and work out which remedy response you've actually triggered by that last remedy you've prescribed, and you know where to go next. So I always cover those 4 areas, or ask patients to provide me information in that format, and also assess changes in the intensity, duration, frequency of each symptom. And it's really just a process of wash, rinse and repeat. So with single remedy prescribing, which is what I do, you take what's better, what's worse, what's unchanged, what's new, and see, is the remedy still matching that symptom cluster? Do I need to change to a new remedy? Do I need to change to a new potency at that point? And then I prescribe a single remedy again. As I said, that's the mountaintop, that's the peak of what we get with that style of prescribing. When you can get a good remedy match with symptoms, you get fabulous results. And case management's very, very easy. For a number of reasons, that's not always possible. It's in the majority of times it is possible. While I would classify myself as what's called a classical homeopath, I have no qualms with parents trying the other options of combinations of remedies, as long as there's no dosing into aggravations, and as long as practitioners are not telling parents it's a detoxing effect when it's not, because we're dealing with children, many of whom are non-verbal, and it's just not a very nice thing to do to them. We can practice a lot better than that, and it's one of the foundational principles of homeopathic practice. Gentle, rapid and permanent.
Wonderful. So I liked what you just said, to remember that very often these children or adults are unable to communicate exactly verbally. You wait for the
Yes.
day when your child can speak to you and tell you, what do you need? Do you need to be nursed or changed or rocked or what? And if they can't tell you, then you have to be ever so much more observant. And one of the things that I continue to tell people is to keep a diary, keep a journal, those notes, so that you can document and record, so that when you do go into the checkup or call the homeopath or the physician, you're able to not just try and recall, but actually have it down, what is going on in changes or no changes. So that's really important. But I loved what you just said about being compassionate with the fact that these people or child may not be able to actually verbally communicate, and they shouldn't have to suffer.
Yes.
Okay, now we're
Very, very, very important. The other, if I could just mention, Debbie, too, because a number of people contact me and they say, oh, look, I took my child to a homeopath or 2 different homeopaths, so I didn't get improvement, and I just don't think homeopathy is going to help my child. I would suggest that those parents try again, or if you hit a brick wall with homeopathic treatment, just stop, and in 2 or 3 years bring your child back again, because often with increasing age things become so much more obvious, symptoms become much more apparent, especially with a child with autism where they're non-verbal, or they don't communicate quite the way. When they're very, very little, we're often left with prescribing the Polycrest our remedies that are the most commonly prescribed remedies because they cover a huge range of symptoms. And thank goodness they do fabulous work for us. But unless a child has a really distinctive, unusual symptom that will allow you to prescribe a less common remedy, such as a hemangioma or a little tumour in an unusual spot, or a bony tumour on the shin bone, or nails that split horizontally or vertically, very distinctive symptoms like that. It can be hard in a young child with autism to actually find remedies needed outside of the polycrest. You really are dependent on those very specific unusual symptoms that indicate a remedy, and usually they're not there, and probably because mostly it is one of the polycrests that are needed. But even so, treatment can stall at times. I would really encourage the parent not to think, oh, that's all homeopathy can do for my child. Try again in 2 or 3 years' time when things are so much clearer and that child's developed a little bit more. Because I've seen people come back even to me in that situation, and suddenly what was so hard 18 months ago or 2 years ago, suddenly it's like you can see the case in a completely different light. You've got the key that's going to unlock it, and the child's away again. So I'd encourage parents to always think of homeopathy. If it didn't work at this point, just try it again in the future. As far as I'm concerned, it should be primary health care for all of us, way through from infancy through to adulthood, and palliating and suppressing symptoms by other means only when absolutely needed, and usually that's not needed.
Hear, hear. I go for that. That was great. And now we want to talk on slide number 40 about some very important work that you're doing that involves the entire community, that is getting just a step up now, beginning, and there will be a website for folks to read, learn, and continue to build. So do you want to talk about your openhomeopathy.com and what it means for the public?
Yes, now I must admit I've got really selfish reasons for doing this, because for years people have saying, oh, Fran, you've got to write a book, you've got to write a book. And I've sat down a number of times and tried to do it, and I always get distracted with something else. And I thought, okay, I've got to do it. I've finally got to do it. And I thought, if I put it online and tell people I'm going to write a book, call back every week or so, because there will be a new section there, I will have to do it. And also I thought it'd be a great way, because what I think people might want to know about, or what's perfectly clear to me with all the jargon and so on I've become familiar with, may not be clear to others, or may not actually be the answers to the questions they have. So there's a survey on that site. If people could just go in and just click what they want, there's areas for comments if they'd like to make new comments. And the other thing I will be putting together too is I want to work with a group of homeopaths who would like to treat autism the way I've just described during this presentation. If they could contact me, I'd very much like to hear with them, because it'd be lovely if we could put together a group to do that and support each other in that process.
Well, I think you kind of put yourself in a position which I find I do for myself and other people do, is if you speak something out loud to other people, then it means that you have to go ahead and do it. And so
that's why I'm doing it. And of course, I'm hoping I want to leave it there too, because I'm very conscious. I come from a fairly affluent country. You do as well. But I know autism's affecting children right around the world. And in many countries, there's just not the money to pay for a Western homeopath, or few homeopaths in that country they can access themselves. So I particularly want to put up there so parents have some idea of what's involved. And I want to talk about the polycrest remedies so that they can see, oh, this may be helpful to my child, or that may be helpful to my child. I want to actually be able to help parents who otherwise wouldn't have, because I absolutely believe homeopathy should be the main treatment for all of these children. The results are dramatic. The results are very rapid when we get the remedy right. And for parents we all love our children, for parents to struggle with a child that they're having trouble helping through lack of money or lack of information, I'm hoping to fill that gap a little bit as well.
And I did write a little article on LinkedIn to introduce folks to you and the issue of autism. There is a bit of statistics that said in the United States it costs approximately $17,000 more each year to care for a child with autism than a child that does not have this disorder. And I mean, people don't have that. And that's talking about probably special therapists and supplements and all sorts of different things. Doesn't even potentially include homeopathy because it's not that widely known. Go ahead.
Mainly referring to the conventional treatments too of occupational therapy and speech therapy and so on. And as many parents out there will know, the other things, the supplements, the probiotics, the thisms, the atoms, everything else that's going on to supporting some of these children, it's hugely expensive.
Very expensive.
The other thing that figure doesn't take into account is the impact it has on a family. Suddenly, the whole social dynamics of a family have to change once they've got a child with autism. They're no longer fitting into their regular social groups. The child can't play with other children properly, or there might be meltdowns or tantrums or freaking out at events and things like that. It changes the way you have to shop, it changes the way you have to socialise, it changes your whole experience of your child's education through school years. It's a huge impact.
It is.
Changes the way you have to cook.
Or you can't go to school and the kids can't participate in a birthday party the same way.
It's horrible.
It's really sad, and we need to do some reparation on that. So I do want to thank you so much. I have some announcements for the folks who are still with us. Let's just take a look one more time at that slide 40 where it says go to openhomeopathy.com and you have /introduction. That will get you there, and there's a survey, and Fran does want to connect with other homeopaths. Then I have an announcement for Just One Drop. We had Laurel Chiton on a couple of weeks back, and there was a big campaign to help her to finish this film she's been working with for 6 years. She's been running around the country, around the world, documenting homeopaths, pharmacies, remedies, all these great things. And she just wrote me a note. Let me see what she said, if I can find it. She although it was a huge success. They did earn the like $80,000 that they were hoping to, but now there's something else happening. May 8th through 10th, there's going to be the NCH conference in Philadelphia, the National Center for Homeopathy Joint Annual Conference in Philly, Pennsylvania, and Laurel will be there doing a short presentation and also filming some more testimonials at the conference. If you're there, say hello. She's also planning to go to Europe at the beginning of June, stopping in London, where they're going to interview a prominent skeptic in the UK, in keeping with her mission to cover the full story, and also to Rome, where they're invited at a homeopathy research institute. And there's just so much happening in the science and research area of homeopathy. She wants to cover that in the documentary. And let's go to so you can go to blinddogfilms.com and lend a hand there. There's a bunch of new perks that you can get if you give a donation. Okay. Thank you. Many blessings to everybody. July, we're going to start with Dr. Pawan Parikh, and he's going to talk about different really important issues, health issues. There is a link on Nissan Communications to the Organic Sufficiency Vitamin Drink with green tea and stevia. I think she also has another product that's like good for gluten. Hey, there's another supplement. Gratitude to Fran for putting this whole thing together and being with us, to Amnon for always being available. Then there's the slide 43. We've got homeoprophylaxis, a worldwide choice for disease prevention. We did not talk a lot about vaccinations and what's happening in the world with that very highly controversial issue today. But if you would like to know about homeopathy and contagious disease and how some people are using it, October 2 through 4th in Dallas, Texas, there will be a big conference, and Dr. Isaac Golden, who has been here on our show before many times, will be speaking. Okay, I'm just sending big hearts of love, homeopathyworldcommunity.com, Facebook, wherever you are. Share this information because the world needs to hear about it. And so I want to say Lila Tov. It's time to go to bed.
My workday begins.
Thank you so much. I think it's in the morning where you are, right?
Yes, it's 10:30.
Okay, well, I'll encourage you to take a nap. Okay, and thank you to all those folks who are listening. I think we probably had over 2,000 views. And Jerry, Michelle, who else was with us? Dr. Bob, Kathy, Corey, a bunch of people were with us on the chat. And thank you so much for being with us tonight. Bye-bye.
Thanks, Debbie. Thanks, Amnon.
You are tuned to the Nissan Communications Network. Our weekly lineup of call-in programs includes Computers 2K Now with Amnon Nissan, Health In with Debbie Bruck, Breaking Free with Marilyn Shannon, Lessons of Vietnam with NCBVI members, The Tanya Love Show, Your Healthy Pet with Gisela DiCarlo. And if you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it at www.nissancommunications.com. Sponsored by Atomus.com, makers of quality video recorders and converters for professionals, CarolinaApparel.com, and DeltaForce.net.